What should transplant patients know about orthostatic postural hypotension?
So orthostatic hypotension, also called postural hypotension, happens when people blood pressure drops when they are changing positions, either from sitting to standing or from laying down to stand. And it's a rapid drop in the blood pressure, and they may have symptoms because of that, right? The main symptoms are lightheaded, feeling dizzy. Some patients may faint because of blood pressure, so there is not enough blood flow going to your brain.
What causes orthostatic postural hypotension during the transplant process?
The causes are multiple during the transplant process, right? Some patients may get dehydrated because, like after the chemotherapy, they may be a little bit nauseated, they may not have an appetite, they may not have any appeal on drinking enough fluids, right? However, we do stress the hydration of the patients, but some patients fall behind, right? So they get dehydrated, and then this orthostatic hypotension can happen. Sometimes this is related to medications, right? Certain medications that we may be giving to the patients may produce this effect. And sometimes the patients are patients with known history of hypertension, and they are taking blood pressure medications. But now that, for example, if they are losing weight because they are not eating the same amount, right, their blood pressure naturally is going to drop as well. And then they are still on these medications that could still drop the blood pressure more. So there is a constant adjustment of those medications, making sure hydration remains also well during the transplant process per se, so that to avoid those things. And then there is also, this could be related to the prior treatment or the chemotherapy that is given during transplant, right? For example, medications like Velcade, like we know, produce neuropathy, right? Neuropathy, one way of experiencing neuropathy is like having the tingling, the numbness in your finger, your toes, sharp pains in your toes, those kind of things, right? But also a different type of neuropathy is something that we call dysautonomy, which is like a poor communication between your heart and your brain, right? Every time you change positions, you move around, you exercise, there is an indication of your brain telling your heart that they need to go faster, that they need to increase the pressure, right? Because there is activity now. Sometimes that communication can be break because of medications like Velcade, because of classic chemotherapy like melphalan, for example. So some patients may develop that because of treatment as well.
How common is orthostatic postural hypotension during the transplant process?
It's fairly common. So that common that, for example, our nursing staff, they have a protocol on when to check. So they have analyzed this, and they have seen the times where this is more common. So they implement this protocol, at least at Moffitt, where the patients get checked orthostatic at different time points. Why? To prevent falls, because that's the main thing, right? You don't want your patient falling. That's really bad for the patient. It's really bad for the nursing care. They are very proud of not having anybody falling, right? And so that allows them, if the patient is orthostatic, then measures needs to be implemented, right? For example, if they are admitted in the hospital, there is this fall precautions that comes, right? The patient cannot move freely unless there is someone with them, right? So there is also in the outpatient, they also, if the patient is doing transplant in the outpatient, there is also more strict control on the intake, right? They are drinking enough or no, whether or not they need to have more IV fluids when they are in clinic, or whether or not they need actually a medication that increases their blood pressure, right? There are medications like midodrine, which what it does, it tightens up the vessels so that the blood pressure doesn't drop when the patients change positions.
How do you monitor for orthostatic postural hypotension?
They do the blood pressure when they are sitting or laying down, then when they are sitting, then when they are standing. And there is a criteria on how much the blood pressure drops in the systolic or the diastolic to determine whether or not this is positive for orthostatic hypotension. At the same time, even though it's not a criteria, but the changes in the heart rate, right? There is some people who have an exaggerated response on the heart rate up, like when they are changing positions, right? So that's also known as postural tachycardia, right? That's also like one of the first, let's say, signs that you see on vitals on your physical exam when you start becoming dehydrated or when this postural hypotension is going to happen.